I'm Dr. Michael Shakro, and this is my Applied Practice Experience Portfolio presentation. This report details the activities and work product from the Applied Practice Experience, APE, documenting practical projects that apply public health theory. It fulfills the APE requirement for graduating from Eastern Washington University's Master of Public Health program. The location, this project was conducted in Glenside Dental. I've been working in that dental practice since 2017. It's a solo practice in Richmond, Virginia, known for its personalized care. The clinic serves a vibrant, socioeconomically and ethnically diverse community, making my role there consistently fulfilling. My site supervisor, Dr. Eileen Shan, she's a Boston University dental graduate. She holds a DMD degree and a master's from China. She served as an assistant professor and Mayo Clinic research fellow. She supervised and discussed all project requirements and steps from start to finish. My role began by meeting my site supervisor so that we can select 3 projects. I then independently researched, drafted materials, and developed detailed PowerPoint presentations for each initiative, consistently following my site supervisor guidance to ensure alignment with our goals. My supervisor from Eastern Washington University was Dr. Devereaux, which she holds a doctorate degree in epidemiology and a master's in public health. Also, I have the honor to get Dr. Kadri, and he is an experienced healthcare executive and a fellow of multiple prestigious colleges focusing on healthcare innovation and education. Both of them, they did great job supervising me and guide me and lead me through this project. So in this project, I'm going to present for you 3 projects we adopted. The first one was named dental phobia and its effects on dental and healthcare. This project has multiple products, and indeed we had like 5 products that we're able to produce through this project. The first product was a PowerPoint presentation. This PowerPoint presentation named dental phobia and its effects on dental health and healthcare for awareness and for staff training. The second project was a brochure. This brochure was entitled Conquering Dental Anxiety, One Smile at a Time, Your Guide to a Relaxed Dental Visit. Third product was an anxiety measuring scale. The fourth one, we did a kind of policy implementation by changing the manual for Glenside Dental to implement how to treat patients with dental phobia. The final product from this project was a kind of a survey, which was after visit form in which we give it to the patient with dental phobia to evaluate how we did during their visits. The second project that we concluded was the necessity of teledentistry. This project has 4 products. The first product was a PowerPoint presentation. Inside that PowerPoint presentation, we did a budget analysis. And the third product was a flyer for teledentistry. And that flyer has a QR code, which links us to the dental form that they can fill so we can evaluate what kind of teledentistry is needed. That's the flyer with the QR code. Also, we had a new patient evaluation form in which we start to give it to our patient to evaluate and tell them how to use the teledentistry. That's the form. The third project that we adapted was the edentulous patient aged 20 to 50 years seeking teeth replacement. In this project, we produced a PowerPoint presentation that could be used for our team in the clinic and also for community clinics so they can be aware about how to help people in this issue. As you see, I developed 3 public-facing dentistry projects. These included educational brochures, flyers for patients and the community to promote informed treatment choices. To support the clinical work, I created a pre-assessment questionnaire for staff to identify patient needs and an after-visit survey to evaluate treatment outcomes. Additionally, I produced PowerPoint presentation to raise awareness about these initiatives. All materials were sourced from reputable research studies, scholarly articles, and governmental organizations to secure accuracy and credibility in supporting both public education and dental practice efficiency. As I mentioned, these are the activities, which are PowerPoint presentation. We produced 3, a brochure, flyer, assessment questionnaire, evaluation form, after visit survey, policy implementation, and of course, budget analysis. The output. I'm going to take each output about each project, and then we're going to talk about it. So project 1, the dental phobia. As you are aware, dental anxiety and phobia hinder care for many. Causes include childhood trauma and fear of pain. Proper management involving assessments, sedation options, staff training, and patient resources can improve experiences, health outcomes, and reduce costs associated with untreated conditions. The outcome for the necessity of teledentistry, as everything now is getting technology involved in everything, teledentistry will enhance access to dental care, to reduce unnecessary emergency visit by 30 to 40% by utilizing HIPAA-compliant technology and efficient workflows. It helps practices like Glenside Dental expand their patient base and improve overall patient care. Tooth loss with the Project 3 affects many adults, primarily due to decay, periodontal disease, and lack of care. This leads to serious health risks and psychosocial issues. Improved access through community strategies, preventive measures, and support programs can enhance oral health and reduce disparities. For Glenside Dental, the output came through combining evidence-based practices and compassionate care to manage dental anxiety. Utilizing screenings, trauma-informed techniques, and teledentistry, the practice increases access and continuously improves care while preventing long-term consequences like tooth loss and systemic disease. Anticipated outcomes. The anticipated outcomes, I divided it here into 3 categories. I'm going to explain each one separately. The first one, let's talk about the anticipated outcomes for our patients. This initiative enhances mental well-being by reducing dental anxiety, improving oral and systemic health through regular care, increasing access via teledentistry, and fostering patient empowerment and satisfaction through collaborative approaches and feedback mechanisms, resulting in better health outcomes. The anticipated outcomes for public health: teledentistry reduces emergency room visits and oral health disparities by enhancing access to care, especially for low-income populations. It improves community health metrics and strengthens healthcare infrastructure, potentially influencing policy changes for expanded Medicaid dental benefits. Anticipated outcomes for Glenside Dental Clinic, the site: enhanced reputation for treating anxious patients leads to increased market share. Operational efficiencies improve profitability. Staff satisfaction rises with the training and support. Data-driven methods enhance service quality and reduce malpractice risk, creating a safer, more effective clinic environment. How the activity was developed. Dr. Shan and I assessed common clinic issues, identifying 3 as major public health concerns. I researched these problems, created PowerPoint presentation, discussed potential solutions, and then developed product drafts, which I reviewed and presented with the supervisor's input. We modified the products to meet the clinic's need, of course, based on staff feedback and patient requirements. Successful implementation has enhanced services and efficiency, with updated policies reflected in the clinic manual. Evaluation of the changes' impact are yet to be conducted. We start giving it to the patient. We got some result, but there is no complete analysis happened yet. Regarding the SEF, we made 5 SEF competencies through these water products. SEF 7, which is assessing population needs, assets, and capacities that affect communities' health, was met through the PowerPoint presentation for the Project 1, PowerPoint presentation for Project 3, measuring scale, and the evaluation form. This competency was achieved by assessing dental phobia through population needs analysis, community resources, and capacities. Key findings highlighted the urgency of intervention due to high anxiety levels, healthcare costs, and the potential for effective coordinated care strategies. The second step that was met was step 8, which include apply awareness of cultural values and practices to the design or implementation of public health policies or program. That was accomplished through the patient brochure from Project 1 and also the PowerPoint presentation from Project 3 and the flyer from Project 2. Glenside Dental policy by applying teledentistry and dental anxiety program incorporates cultural awareness by addressing barriers and offering accommodations. It respects diverse patient needs, enhance access through remote services, and provide resources to support varying health literacy and self-management preferences. Competency number 3, which was the SEF number 9, design a population-based policy, program, project, or intervention, and that was met by the policy implementation that we adapted through the Glenside Dental Manual for the dental phobia related to Project 1. Glenside Dental Policy addresses dental phobia through a structured intervention that includes screening, preparation, in-visit support, environmental modification, staff training, and referral pathways, ensuring improved access to care and better outcomes for vulnerable patients with anxiety. Step 10, explain basic principles and tools of budget and resource management was met through the budget analysis that happened for Project 2 in the PowerPoint presentation. The budget and resource management plan for the teledentistry program outlines capital and operational expenses, utilizes cost-benefit analysis, ensures proper resource allocation, and connects financial investments to public health goals, enhancing access to care and reducing emergency room overcrowding. Competency 11, select methods to evaluate public health programs was met through the after-visit survey that we use in Project 1 for the dental phobia that we gave it to the patients. The dental phobia patients after-visit survey uses mixed methods to evaluate a public health program aimed at reducing dental care barriers. It combines the quantitative data with the qualitative data to assess program effectiveness and improve patient experience and inform continuous quality improvement. Initially, uncertain about starting the APE course, I found focus and interaction after selecting public health subjects with my supervisor. I dedicated substantial time to researching each topic's community impact, which helped me address key issues and promote public awareness. Through this work, I gained deep knowledge of the subjects and how to meet public needs, learning to create effective flyers, brochures, and to clearly explain issues to the clinical team. Developing surveys and evaluation tools taught me to strategically communicate for the best result. This entire process provided a strong foundation for creating and implementing effective policies, making it a highly valuable experience overall for me. These are the appendix that I use, and the one in green is the one for project 1. The second 3, the blue one, is for project 2, and the final one is for project 3. Thank you very much for all your time, effort, much appreciated.